I'm pleased to welcome one of the expert panelists I worked with on the lung cancer research, Alfonso Aguarón. And with him on the panel right now, we have Helmut Prust and Anna Batistatu. Over to you, please, Alfonso.
Well, thank you so much, Mary, for this introduction. Well, I will try to be very brief to give some space for the panel discussion. But I would say, I would like to start by saying that lung cancer, as you mentioned in your introduction before, remains as the most diagnosed and one of the major cancer killers worldwide, only surpassed by cardiovascular diseases. So the welcome introduction of new treatments and a better knowledge of the disease biology, lung cancer is still diagnosed in later stages commonly, something which is leading to poor survival outcomes and a high burden on the quality of life of patients and caregivers. But beyond that, and something quite important coming out from the Europe's Beating Cancer Plan, an initiative of the European Union to tackle challenges in prevention, treatment and care, clearly states that 40% of cancer cases are preventable only by putting in place measures that we already know about, such as prevention campaigns, screening programs, updating national cancer plans, and putting early interventions in place to enhance an earlier and a more accurate diagnosis. And this is something that really well applied to lung cancer. So let's say that the diversity and the heterogeneity of the European health systems, as you very well shown in the results of the analysis developed by the Economics Intelligence Unit, drafts a scenario of disparities and inequities in many different aspects that goes from prevention awareness to access to an optimum care. So this comparative analysis of lung cancer policies across Europe, put in this report in the Breathing a New Era, clearly reflects that late diagnosis, poor access to treatment, and a mixture of fatalism and stigma has meant that outcomes are often poor for people with lung cancer, something which can be clearly improved by taking the proper action into the 5 different domains that you have mentioned before. So when we analyze the particular case of Greece in comparison with its European neighbors, there is clearly a space for improvement. So despite the fact that lung cancer in Greece is considered as a public health issue, I think that the holistic approach is needed in order to tackle those challenges previously mentioned. One of the key suggested goals Greece needs to achieve is to have an updated national cancer control plan in place in order to really ensure an earlier and a more precise diagnosis of lung cancer, which is early actions and interventions. Also, and I think this is something that it will be mentioned by one of my colleagues in the panel, at the light of results of studies such as the Nelson trial, which shows clearly benefits on the use of regular low-dose CT scans on high-risk populations. The implementation of systematic screening programs across the country may lead, of course, in cost-effective intervention, but what's more important, saving people's lives. And last but not least, as a representative of a patient advocacy group, I think the participation of patient organizations in decision-making body needs to be a priority with 2 aims. First of all, to raise awareness on those issues and challenges patients and families are dealing with. And secondly, to take an active part into those processes to go beyond the fact of just stating the problems to become part of the solution. And at this point, and to finish with my intervention, I would like to mention that the fact of seeing an increased level of patient advocates in Greece in the country, such as, for example, the recently created lung cancer patient group Fair Life Lung Cancer Care, certainly can add value to new policies that can incorporate the patient vision in this call to action to improve the situation of people living with lung cancer. So I give the floor to the next speaker, and I thank you so much for your attention.